what we say is that you should have a risk assessment first, and that should say whether people need PPE.
Understood. Right. Let me bring in Professor Saul Faust, who is a specialist in paediatric infectious diseases at the University of Southampton. He has co-authored a paper which has been peer-reviewed and was published in the British Medical Journal on May the 5th, called "Children Are Not Super Spreaders, It's Time to Go Back to School." Professor Faust, good morning to you.
Good morning. It's actually in the Archives of Disease in Childhood, which is a paediatric journal.
I beg your pardon. That is absolutely key.
Not quite as good as the BMJ.
Sorry, say again.
Not quite as good as the BMJ.
Okay. But it has been peer-reviewed, is that correct?
It is true, but I find myself agreeing with all three of your speakers who've all made some really, really important points. And although we know that children get less severe coronavirus disease and transmit less between themselves and are very unlikely to be a risk to teachers, our paper was written in the context of lockdown and talking about how society should begin to reopen from a place of low infection. And it's absolutely the case that schools have to work out how to operate. I've got young children myself. It's not possible for children to social distance. Miss McCarthy was absolutely right. Even the year 5 and 6 pupils will inevitably end up touching each other if there's low disease in society, and if we're watching and tracking and tracing and testing and quarantining and using apps to make sure we clamp down on infections as they arise. You know, hospitals have gone through 2 huge transformational changes in the last 3 months. We had to turn the whole hospital into COVID hospitals, and now we're having to change again into COVID, non-COVID areas of every hospital in the NHS to be able to manage normal business. And Miss McCarthy's absolutely right that schools need time to work out how to do that transformational change.
Okay.
And it's broken my heart this weekend, and I think every doctor in the country is looking at this going, why are we politicising children? Why are we arguing between the unions when what we should be doing is concentrating on getting test and track and trace on one hand, and letting the educationalists sort out not just in schools, but how they're going to get children to and from school.
Sure. Can I ask you the question that I get asked the most on social media, to ask people like you, what is the risk of let's just put this into context. We know from the ONS analysis last week that children are as likely as adults to contract COVID-19. It's also true that they're much more likely to have no symptoms or very mild symptoms. But what is the risk of transmission from a child to an adult? Because that is the thing that's worrying parents and teachers.
So I think the ONS data is the ONS data based on symptoms. There was also a study published last week, though not yet peer-reviewed, from Spain, which was based on antibody testing in 70,000 people, which showed only 1 to 3% of children had COVID, whereas well over 5% of the adults had COVID. So I think the data globally is very variable, and the ONS data is surprising and not necessarily backed up by antibody testing, which is coming, and there's studies going on in the UK to look at antibody tests in children. So we've looked, lots of people have looked back at what's available as the pandemic started and in places that are reopening. And in both cases, it looks mostly as if where children are infected, they're getting infected from adults, and they're not infecting the adults in the school environment.
Okay.
And that's even the case with a case in Austria over the weekend where... Sorry, I interrupted you.
No, it's fine. You carry on with the Austria study, because I want to bring in the Australian study in a sec.
There was a news report of a kindergarten that got closed, and a sensational kindergarten that got closed because of a case. If you actually read the article and translate it from the German, it turns out to be a kindergarten teacher was infected and no mention of the children whatsoever. So I think the risk is to adults, and that's a real risk. And I agree with the speaker from the unions who says, we need risk assessment. As we do in hospitals, we need risk assessments. I agree with Miss McCarthy, who says the teachers and schools need time to undergo transformational change and remember children are children, and we won't be able to social distance entirely. And of course, as parents, everybody's desperate to go back to work. But until we have effective testing, tracking and tracing and quarantining, we're just going to go in and out of these arguments and blame each other for things going wrong, instead of focusing on what the country used to be brilliant at, which was public health efforts, stopping infectious disease.
What level infections, new cases would have to fall to for the test and track system to be effective? I looked at the new cases for the last week, and we're about 3,500 new cases a day. What would it have to fall to, Professor?
I don't think I'm going to speak out of my area of expertise,
Okay,
and there are other people
fair enough.
who talk about it.
Have you seen the Australian study, which is apparently the only major study of the transmission of COVID in primary and secondary schools? It looked at transmission from 18 infected students and staff in 15 schools. They came into contact with 843 students and staff. Only 2 children were found to have contracted the virus from those 18 who tested positive.
So those numbers sound slightly different from a similar Australian study we quoted in our paper, but they might have updated their data. I think that's, we know, and the WHO paediatrician has spoken again this weekend, that children are not seeming to transmit this infection between themselves and to adults in a way that they do with all the other respiratory viral infections or influenza or any other cold. We don't really understand this, and we need to work out what's going on. The only thing we can say pretty much for certain is if we're in a low transmission environment with low disease in society, the schools would be a good place to start to open up, because that spread to adults will be much less than getting everybody back to work and public transport and offices. And the risk to all our families and the older people in our families will be less by starting with the schools than it will by letting everybody back to work and then everybody coming home and infecting us all. Sure. So this is incredibly complicated, and somehow we need to step out of the politics and actually sort of do what people are good at, which is operationalise how to move forward once we've got the testing, tracking and tracing and quarantining in place. Because unless that's in place, we're just going to go in and out of lockdown for the next till we've got a vaccine.
Can I ask you one more thing, if I may? Many of us want certainty. Scientists can never guarantee 100% certainty.
There is none.
There is none, exactly. But journalists like myself still ask for a 100% guarantee, and it must be really, really annoying and frustrating for you. Can you give us some insight into how we should rationalise the fact that we are going to have to live with some level of risk? That there isn't going to be 100% safety when we leave the front door?
That's exactly it. We all live in a society where we have a risk of sepsis, or I send my kids off to school in the morning and the 2 older ones have to cross a busy road on their way to their secondary school. Yeah, they're with their friends, but it's a busy road. We all accept risk in our lives. Many people smoke, many people drink. Having coronavirus in society until we have a vaccine, until the disease is eradicated, is exactly as you've just said. We have to somehow come to terms with that risk. And it's really hard because the media messaging makes everybody scared, because that's the way to keep people at home. And then suddenly says to everybody, okay, well, it's okay for some of you to go back to work again now. And we need the information, we need to study what we're doing, and we need to be open with people and explain it without this incessant politicisation that's happened this weekend, where people take small quotes and sensationalise it. And I know that's the way the world works and the way the media works. But I'm sure Ms McCarthy and others will agree with me. That's not helping us get kids back to school.
Thank you very much. Really, really interesting and insightful. Thank you to all of you. Professor Saul Faust, specialist in paediatric infectious diseases at the University of Southampton. John Richards, many thanks for your time, from the union Unison. Mary Ellen McCarthy, thank you, executive principal of the Lumen Learning Trust. And Lee South, dad of 2, who is sending his year 6 daughter back.